So the deep cervical flexor endurance test is going to be looking at the endurance, the longest coli, longest capitis in particular. And so the best way to perform this test is in a supine position, okay, and no pillow, all right? And the goal of this is to determine if someone can hold their head off the plinth, okay, for a length of time. And the length of time, as much as we would want a specific number, it varies a little bit throughout the literature. But I usually aim for trying to see if a male can hold it 25 seconds and females for 20 seconds. And again, we have all the statistics in our book on migraines, people with neck pain, people without neck pain, and it's just a little bit all over the board. And at the end of the test, I'll add a little caveat to what we look for in addition to what is utilized in the literature, okay? So how you perform the test is you're gonna ask the patient to rest the back of their head, and you have your second and third digit right here on the table, okay? And then from there, I'm gonna say, hey, tuck your chin as far as it would go, but keep your just like this, okay? And so the goal is to get a little bit of a wrinkle here, and this is tells you that you're able to maintain OA flexion, okay? In some of the research studies and stuff, they even go as far as like putting a little pen mark here so you can see a straight line, okay? And after that, what you're gonna ask the patient to do is lift their head just slightly off your fingers, and we're going to have her hold that isometrically. Okay, so you'll be looking for several things. You'll hit your timer as soon as the individual lifts their head off your fingers. And second of all, you're going to be looking for basically 4 criteria that would say that the individual fails the test. Okay, so the first criteria, if they fail the test, is if they obviously get to this point and, oh, it hurts. They literally can't do it. Okay, that would be number 1. Okay, number 2 is a little bit what Liana just did. If I have my 2 digits here, if she lifts her head and then she lifts it up into a lot more cervical flexion, like so, okay, that would be number 2. Okay, number 3 component is when she tucks her chin completely, and I ask her to hold that she can't maintain that OA flexion, and her head will kind of tilt back like that. Okay, so that would be the 3rd component. And the 4th component is when my 2 fingers that are stacked under her occiput back here, if she rests her head on my fingers as support, okay? And so there are 4 criteria to the test, all right? And you can give the patient a cue, like say they are holding their head isometrically there, and then they lift it up higher, say, oh, don't lift it up, bring it back down just to the top of my fingers, because as she's holding that, my fingers are just gonna kind of be behind the occiput like so, because the back of the head should just be just above the fingers, okay, and not resting on it. Okay, so this would be the cue for it, and then we're going to have the caveat at the end as well. So I'm going to put my 2 fingers right at the occiput. You rest there, and then just tuck your chin as far as you can, and now just lift your head just slightly right there. Good, and keep holding. You're doing good. Keep holding. And then she would do this as long as she can with the timer going for, say, 20 seconds or 25 seconds. And I'm trying to keep it, it's a little hard for her, so she's going into a lot more cervical flexion, okay? And so that would be something you'll want to be aware of. All right, the other caveat that we like to do is the location of where somebody feels this. And this is the biggest caveat because I think we have a lot of literature all over the board to the seconds, okay? And we know this is for the longest capitis and longest coli, so if we're actually trying to train those muscles to test them, we need to see if they're actually working. So basically, I would also ask the patient, hey, where did you feel muscles work? And the goal is for them to feel it in the neck, especially right here, sort of near the trachea, deep here. What if they say, hey, I feel it right over here? Then we know, hey, that's the sternocleidomastoid kicking in, all right? Or they may feel it way up at the occiput, or it could give them a headache, or it could give them lightheadedness. So those are little caveats that isn't in the literature, and that would be when we go into actually treating it, we want to make sure that we train the correct thing.